Today we will be talking about the androgen insensitivity syndrome. So first of all, what causes androgen insensitivity syndrome? And so what happens here is that there are androgens which are obviously you all may know are the male reproductive hormones. And so the androgens there is insensitivity of the body to androgens, so the androgen receptors are not working. Androgen receptors, they are not working, so they're blocked. So and it's an X-linked. You should know that it is X-linked disorder. So androgen receptors are not working. So let's say, so if the androgen receptors are not working, obviously what would the body look like? So let's say, what are the male features? The male features. What are the cause of male features? Why do we have male features? And the reason for that is the androgen, right? But what if the androgen is not working? So you will look like a female. So there will be female characteristics. So your body will be just kind of like a female. So it will be male genotype, which is the XY. So the patient will have, when we do karyotyping, so it will be a XY karyotype. But the features will be of females. So the features will be of female, and so let's say we will have first of all, like if obviously genotypic karyotype, so genotypically it is male, there is Y. So whenever there is a Y, just remember, whenever there is a Y chromosome, there will be testes formation. So there will be testes formation in the patients, so there will be testes. But the thing about these testes is that in androgen sensitivity syndrome, they will not be palpated in the scrotum, and these are called crypt orchid testes. And another thing is the external genitalia. So obviously, because there is no androgen and the androgen is not working, androgen is required for the external male genitalia. So the external male genitalia will be absent. So testosterone is normally converted to DHT, which is dihydrotestosterone, by 5-alpha reductase, and this DHT then go on to form the external male genitalia. So these include, for example, the penis, for example, the prostate. So these are the external male genitalia, and the scrotum, obviously. So the external male genitalia are dependent on DHT, and DHT dependent on testosterone. But these androgens, they don't work because of the receptors. The receptors are defective. There is X-linked defect. So these androgens will not work, and so when they don't work, this male external genitalia will not be formed, and so when external male genitalia will not be formed, then automatically the body is going to form female external genitalia. So these patients will have female external genitalia, so there will be vagina. But the thing is that it will be short. Only the lower two-thirds of the vagina will be formed. So it will be a short vagina, and so this is one feature. So there will be female external genitalia, and there will be absent male external genitalia. So that's the first feature. And then another feature would be that because there is resistance to androgens, there will be absent or minimal axillary and pubic hair. So because of the peripheral resistance to the androgens, so there will be absent and minimal hair in the axillary region. So in the axillary region there will be minimal hair. And then the next feature would be the breast. So obviously, because the androgens are not working, when the androgens are not working during the puberty, there will be increased estrogens, right? And what would the estrogen during the puberty do? So let's say there is a puberty. Puberty would result in increased estrogen, and that estrogen, because it's unopposed, because androgens are not working, so it will result in breast development, and also it actually they call something called the Stahl stature. So breast development, the main feature here. So you should know, especially for step 2, is that the androgen insensitivity will have breast development at puberty. So this is a really important finding. So now all the features are present. So female external genitalia are there, breast development is there during puberty, and so far it will physically everything is just female. But the thing is, so I'm gonna just now ask you a question. So if you do a pelvic ultrasound of this patient with androgen insensitivity syndrome, what are you gonna find on the pelvic ultrasound? Would you find like the female internal genitalia, like the uterus, like the ovaries and those things? And so no, so you are not gonna find, okay? So you're not gonna find, so there will be no uterus, there will be no uterus, there will be no there will be no ovary, and there will be no upper third of the vagina. So here, like we would have the lower 2/3, but we won't have the upper third of the vagina. So now, so what is the management of this condition now? So just to recap, so we will recap later. So what will be the treatment? What will be the management? So the management is just there are cryptorchid uterus, and cryptorchid uterus, remember, cryptorchid uterus are at increased risk of malignancy. So increased cancer risk, and for the malignancy risk, we have to remove them. So we have to do gonadectomy. So that is just the main management. Or obviously there is just gender identity counseling is another feature, another management strategy that should be in place for these patients. So this was just a general androgen insensitivity syndrome. And then I think the most important thing that you should differentiate this androgen insensitivity syndrome, the main thing that you should differentiate it from is the 5-alpha reductase deficiency. And so we talked about it. So the 5-alpha reductase deficiency, what is it doing? So it's actually converting testosterone. So there's testosterone, and it's converted to DHT. So this is where 5-alpha reductase act. So when it's deficient, we won't have DHT, and we won't have external genitalia. But now remember that because the testosterone is still working, there will be no breast development. So that is the main thing. So in AIS, we will have breast development. In 5-alpha reductase, there will be no breast development. And another feature of 5-alpha reductase is that because at puberty, there is actually increased testosterone, right? So enough testosterone is produced that it overcomes this deficiency of this enzyme. And so it will form DHT. And that DHT can cause then virilization, like clitoromegaly. So clitoromegaly or virilization is one, like deepening of the voice, clitoromegaly. So they will be present, and there will be breast development. So the breast development, and these are the differences. So now let's just write how are we going to differentiate. So let's say this is AIS, and this is the 5-alpha reductase deficiency. So there will be breast here, breast will be positive. There will be formation of breast, and here there will be no breast development. Because testosterone is still working, such just that the DHT will not be formed. And number second, there will be no virilization at puberty, and here there will be virilization. Clitoromegaly will be present, and there will be, for example, deepening of the voice. So these are some signs of virilization. So now let's just recap here. So we talked about it. What is the cause of androgen sensitivity? It's just the mutation in the androgen receptor, and it is X-linked, so the androgens does not work. And then it will be a male gene. So if you do karyotype, it will be XY, and then it will look like a female. It will be female phenotypically. It will be female, like we talked about, female external genitalia. There will be breast development. So all those features will be present. So female external genitalia will be present. And then there will be, if you do ultrasound, you won't see any uterus, upper 1/3 of the vagina, and no ovaries. And then the testes will be present, but they will be cryptorchid, which means that they will not be in the scrotum. They will be up. They will not be palpated. And then breasts are present. Okay, so this is the versus 5-alpha reductase. Reductase will not have this breast development. Then minimal axillary or pubic hair because there is androgen resistant. And the management is just you have to prophylactically remove the gonads to decrease the cancer risk. And so because cryptorchid, they are associated with increased risk of testicular cancer. So that should be that. So this is androgen sensitivity syndrome, and hope it was helpful.